We will cover the 5 most common types of arrhythmias, how to spot them, and what to watch out for to avoid life-threatening complications. And arrhythmia is any abnormal heart rhythm. Heart rate can be faster than normal, which is known as tachyarrhythmia. It can also be slower than normal, called bradyarrhythmia, or present as an irregular heartbeat. Generally, arrhythmias with a fast heart rate are more common than others. The first and most universal symptom of arrhythmias is palpitations, which means the sensation of feeling one's own heartbeat. Usually unnoticed in normal cases, palpitations are subjective. Some people describe them as sensations of rapid fluttering, pounding heartbeats, or racing and flip-flopping. The second most important sign of arrhythmia is an irregular pulse, which can feel like uneven or skipped beats. This irregular pulse is a key sign of the most common arrhythmia, called atrial fibrillation. Atrial fibrillation affects almost 2% of the general population, especially after the age of 65, affecting almost 10% of the older population. People with atrial fibrillation notice a sensation of a rapid, fluttering heart. Unusual tiredness and reduced physical activity tolerance are common. They may also experience difficulty breathing, especially during physical activity, along with dizziness and lightheadedness. Before the heart contracts, an electrical impulse occurs. This impulse should normally be rhythmic. In the case of atrial fibrillation, disorganized and chaotic electrical activity occurs, usually due to fibrosis of heart tissue, hypertension, and age-related changes in the heart. Instead of originating from one location, the sinoatrial node, electrical impulses come from multiple locations in the atria. This causes rapid and irregular atrial contractions, sometimes at a rate of 300 to 600 beats per minute. The atria contract irregularly and are unable to pump blood into the ventricles effectively. While the sinoatrial node conducts impulses randomly, the ventricular beat is around 100 to 160 beats per minute. On the electrocardiogram ECG, we see irregular waves called fibrillatory waves, which are a hallmark of atrial fibrillation. P waves are not present on the ECG, indicating no atrial contractions. The heartbeat is irregular and fast. The main goal of treatment is to decrease the heart rate and restore a normal rhythm. For heart rate control, beta blockers, calcium channel blockers, and sometimes digoxin are used. To restore normal heart rhythm, antiarrhythmic drugs like amiodarone, flecainide, flecainide, or Sotal are used. If treatment is ineffective, electrical cardioversion or catheter ablation may be necessary. The most important risk of atrial fibrillation is that it significantly increases the risk of blood clot formation. These clots can lodge and travel through the body, potentially causing a stroke or intestinal thrombosis. This risk is particularly high in older adults, which is why anticoagulant therapy is crucial in such cases. Anticoagulation is usually a long-term treatment and sometimes a lifelong therapy. The second most common arrhythmia is premature atrial contractions. It usually develops without symptoms and is more common in older individuals. It can also occur in healthy people and be triggered by stress or caffeine. This condition is usually harmless and does not carry significant risks independently. However, it can increase the future risk of atrial fibrillation. Typically, it does not require specific treatment, and reducing alcohol, tobacco, and caffeine is helpful in many cases. The condition occurs when an electrical impulse is created prematurely in the atria, outside the sinoatrial node. This impulse causes an atrial contraction, and then it spreads to the ventricles, causing a premature ventricular contraction. Therefore, it results in an additional premature heartbeat. After this, the normal sinoatrial impulse is created, and regular heartbeats follow. On an electrocardiogram ECG, this is seen as an early P wave with a normal queers complex. Another important arrhythmia is premature ventricular contraction. It means that an electrical impulse occurs in the ventricles ectopically. This impulse bypasses the normal electrical pathway and causes the ventricles to contract before the normal impulse from the atria arrives. Stress, caffeine, alcohol, nicotine, exercise, and certain medications can trigger such ventricular contractions. Also, underlying heart disease and electrolyte imbalances can have an effect. Many people feel no symptoms. If they do notice, they might experience palpitations, often described as a fluttering, pounding, or the sensation of a skipped beat. The term skipped beat is used because after a premature ventricular contraction, one normal beat is skipped and the next heartbeat is late, which is perceived as a skipped beat. This is called a compensatory pause. If such premature ventricular contractions are symptomatic and frequent beta blockers are used. However, in many cases specific treatment is not required and lifestyle modifications are usually sufficient. Although this arrhythmia is benign in most cases, if a person already has heart disease, it can increase the risk of serious arrhythmias like ventricular fibrillation, which can be life-threatening. On ECG, premature ventricular contractions appear as wide, and bizarre curse complex is not preceded by a P wave, followed by a full compensatory pause. Another important arrhythmia is ventricular tachycardia. Ventricular tachycardia is not a very common arrhythmia, but it is more prevalent in people who already have heart disease, such as individuals with myocardial infarction or cardiomyopathy or myopathy. It is a rapid heart rate originating from abnormal electrical signals in the ventricles and can be life-threatening, especially if it is sustained. During an episode of ventricular tachycardia, a person may feel palpitations, chest pain, dizziness, or experience syncope. There may also be difficulty breathing. Sometimes this arrhythmia can lead to hemodynamic instability, low blood pressure, and even shock. On an electrocardiogram, ventricular tachycardia presents with wide curves complexes, usually more than 1 to 2 milliseconds, and a fast heart rate, typically more than 100 beats per minute. This occurs because the electrical impulses are not following the conventional pathway and require more time to spread. Because ventricular tachycardia carries a risk of sudden cardiac death, it always requires treatment if it lasts more than 30 seconds or is symptomatic. Treatment may include antiarrhythmics like amiodarone, procainamide, or lidocaine. If medications are ineffective, cardioversion is performed. If the patient becomes pulseless, defibrillation is used. Another common type of bradycardia is sinus bradycardia. It is common in athletes and occurs during sleep in healthy people. It is generally benign and does not cause any serious complications. In this condition, the heart rate is usually less than 60 beats per minute, and it originates from the sinoatrial node. When such a rhythm occurs in athletes or during sleep, it is considered normal. Additionally, if a person has no symptoms and no other associated conditions, it can also be normal. In individuals who do experience symptoms, these can include fatigue, weakness, dizziness, and lightheadedness. On an ECG, there are no significant signs except for the slow heart rate. Atropine is the first-line medication for symptomatic sinus bradycardia. It blocks the vagus nerve and increases the heart rate. Atropine is usually given intravenously at a dose of 0.5 milligrams. If atropine is ineffective, dopamine and epinephrine can be used. A permanent pacemaker implantation is the long-term solution, especially if there is a high degree atrioventricular block or sick sinus syndrome. The most common cause of symptomatic sinus bradycardia is age-related structural changes in the heart.